Good morning, everybody. I need to turn my camera on for y'all. Good morning, everybody. My name is Kimberly Meck, and I am the Executive Director of Disability Empowerment Center. And we are proud to present our May Understanding Ableism event. Sorry, I'm just getting things a little organized for myself on my computer screens so I can find everything. Sorry. So, I am a white female, and I am wearing a blue hoodie over a red plaid shirt, and I have my hair up back of my head and sunglasses on my forehead. And behind me is a desk lamp that is very, very light, white, right? Make things easier. And you can see a whiteboard that's covered in writing that hasn't been erased in a month. Captions are available in Zoom. You can click show subtitle or show captions in your Zoom menu bar. Captions are also running on stream text, and that URL is way too long to read, but you can click on the link that has been put into the chat to access them. And ASL interpreters are available today. We are presenting in gallery view, so the captioner should always be visible. If you pin one or the other, then you might not be able to see the interpreters after an interpreter change. You do not need to be on Zoom to access this event, and we will read all questions out loud and voice any images on the screen. This event is being recorded. And we will answer all questions periodically throughout the discussion. There is a Q&A tab that you can use for questions that you have for the panelists. And then you can use the chat tab for general conversations and comments. And just a note, we will use both person with a disability and disabled person interchangeably, recognizing that people have a preference for either or. So I just want to take a moment real quick to let you know, originally our 2025 Understanding Ableism events were being hosted by an AmeriCorps member. His name was Colin Wilfred. And unfortunately, because of some changes within the federal government, the AmeriCorps programs were terminated and shut down. And so unfortunately, that meant that Colin had to leave us. And so we are operating without him. We're sad. We miss him. We wish he was still here. That and our other AmeriCorps participant, Christine. They are truly, truly missed. And Colin put into chat, I miss you too. And at any given point in time, if AmeriCorps is able to return, they will be welcomed back with open arms. But that being said, we do need to move on today. And so I would like to introduce your moderator for today, Mariel.
Hello, everyone. My name is Mariel Woodley. My pronouns are she, her. I'm the outreach coordinator at the Outreach and Education Coordinator at Disability Empowerment Center. I'm a white female with clear glasses and long brown hair and a gray sweatshirt. This is the fourth session of the 2025 season for the Understanding Ableism monthly series. These events are hosted by the King County Disability Consortium, which is composed of over 40 disability-serving organizations and individuals, and individual disability advocates and activists. The Understanding Ableism events are led by the disability community. I'm sorry. They're led by the disability community, promoting disability justice within the King County enterprise. This is the fourth episode of Understanding Ableism series and the 2025 season. We will be discussing long COVID and the impact on the disability community. One of the most significant reasons why the COVID is over bandwagon is harmful to the disability community is because of long COVID and its disproportionate impact on people with disabilities. In case you didn't know, long COVID is a type of COVID-19 infection where the host's symptoms are more severe and lasts a lot longer than 1 or 2 weeks when people normally recover from COVID-19 by. According to a 2024 report from the National Institute of Health by Jennifer Cohen, excuse me, and Jana van der Meulen Rogers, 50.4% of people with a pre-existing disability who have had COVID develop long COVID, while 29.2% of people without a pre-existing disability who've had COVID develop long COVID. This shows that long COVID disproportionately impacts the disability community, and the removal of covid-cautiousness practices can hurt our community. Since people with disabilities are more likely to be in positions of power, since people without disabilities are more likely to be in positions of power and less likely to develop long COVID, cautious people without disabilities put people with disabilities' lives at risk because they do not think long COVID was their problem. To help us all understand why long COVID should be a concern for our community, the KCDC team has invited people who have seen the disproportionate impact long COVID has on the disability community themselves. They're eager to talk about their experiences and what they would like people to learn who have never had long COVID nor seen its impact on people with disabilities. All right, so then I'm going to post a link into the chat that contains the questions I will be asking. We have Dr. Khan and Cynthia Coffin, who are both here today to speak on behalf of long COVID. So thank you both.
I actually pasted it in for you already.
Oh, thank you, Kimberly. All right. So each panelist, I would like to invite you to introduce yourself with your names, pronouns, visual description, where you're from, and your connection to this topic. Dr. Khan, would you like to go first?
Sure. Thank you so much for having me. And I will also shout out Colin, who initially invited me here as well. So I am Zeest Khan. I use she, her pronouns. I am olive skinned, black hair, shoulder length, but that is white in the front. And I'm sitting in my home office with a tapestry behind me. I am a physician in Northern California who fell ill in 2020 while I was caring for people during the beginning of the pandemic. I fell ill and continued to get ill. By the end of 2020, I had a really hard time walking. By the beginning of 2021, I could no longer walk even a short distance. I took medical leave then, and I have still yet to return to my anesthesiology practice. Instead, I have pivoted towards spending my time as I have recovered in improving understanding of long COVID and helping patients navigate the healthcare system that can be very, very confusing. I was bedbound for close to a year, and my appreciation for the work that disability advocates have done thus far expanded tremendously, and I hope to improve on or contribute in any way I can.
Thank you. Cynthia, would you like to go next?
Yes, my name is Cynthia Coffin. My pronouns is he, her, hers, and I'm wearing a orange, white checkered shirt with a lanyard that says Disability Empowerment Center. I have blonde hair, and I'm Caucasian. The experience that I have with long COVID, back in 2022, I got COVID at the National Federation of the Blind Convention, and I was sick for 2 weeks. About a month later, I ended up going to the long COVID unit. I had to advocate for my doctor to send me there. I gave her a long list of symptoms. And when I went to the long COVID unit, they referred me out to specialists, to a heart specialist. They also referred me to a sleep apnea specialist. And I wasn't, full disclosure, I wasn't actually diagnosed with long COVID, but I have experience going to the unit and experience working with a long COVID doctor. And I want to advocate for people that have had long COVID and to make things more accessible for long COVID people who have had it.
Thank you. And then we're also joined by Vicky Navarro. If Vicky's here, welcome and thank you so much for coming. I would just like to ask you to introduce yourself with a visual description and where you are coming from, please.
Hi, everyone. I'm Vicky Navarro. I use she, her pronouns. I am wearing a black coat and also a beanie with a blue and gray hat. And it's an honor to be here. I'm with King County Public Health as a community navigator and also with King County Promoters Network, where we are also like a providers network. I'm here today on behalf of, of the community and also other leaders in the community and also who have also experienced COVID, long COVID during the duration of the early set off. And I'm just here to know that we are here to provide, any kind of connection of resources that we can be able to support with. Thank you.
Great, thank you all very much. And so we will start with the questions. I'm going to go in the order of Dr. Khan first, then Cynthia, then Vicky. Okay, so the first question on the screen you can see is, how can medical research and practices better address the fact that long COVID disproportionately impacts the disability community?
Well, I think the key here is accessibility and making sure that people who need access to care are able to receive it. The telehealth that was expanded during the beginning of the pandemic helped improve accessibility of patients to their healthcare providers. That has been limited again, I think about a year ago, or maybe even longer than that. But allowing patients ways to reach their providers and to reach researchers is really the key here. What I've been seeing, fortunately, is even though some of our interstate telehealth accessibility has been limited again, research on long COVID is trying to improve the ability of patients to participate in research by decentralizing research practices. So traditionally, researchers would, for clinical research, would ask patients to travel to research sites. The research sites are typically in university settings. Those are often places that patients have to travel to. And if you have long COVID and even a pre-existing disability from that, long COVID for most people is a fatiguing illness, and it is very challenging to repeatedly travel for research to be involved in research. So recently there was a University of Minnesota study studying several drugs that might reduce the chances of developing long COVID by intervening during a COVID infection. It was called a COVID out study. I covered that in one of my podcast episodes. And the way they structured that study was decentralized. They sent medications to patients to use in their home. They communicated with patients using telehealth and the phone. So patients did not have to travel repeatedly into research sites. Reducing the number of blood draws also helps with this. But when we're focusing on clinical research, we can get a history without patients having to come in. We can check blood pressure now at home and vital signs like pulse oximetry at home. And so I think the key for long COVID research is accessibility. And this is what the disability community has been advocating for before COVID and long COVID came on the scene.
Thank you, Cynthia. How can medical research and practices better address the fact that long COVID disproportionately impacts the disability community?
Just reiterating that it would be really good if people can share their stories about long COVID and people coming together and just talking about what they've been through with long COVID. And one research, but a good idea for research is how coordinated care is assisting people with disabilities and being able to overcome long COVID and making connections in the community to receive services to be able to get back to normal and is a good idea. And just reiterating what the first speaker said, continuing to do research in the universities and the long COVID unit is a good idea.
Thank you. Vicky, how can medical research and practices better address the fact that long COVID disproportionately impacts the disability community?
I agree with the doctor and the last speaker. I just know that stories are the best to help understand what people's journey has been going through. Also, research and designing policy about long COVID. Many studies are, trying to find reducing the findings. We also need to find data collection, and then also partnerships with disabled communities so we can collaborate and advocate to co-develop care guidelines and education materials and support networks. Also, providers education. How can we also train healthcare professionals and also community members to recognize about the long COVID symptoms that has been happening in our community. And we want to be also trusted messengers to the community that we need to know that we care and that we don't ignore any kind of, whatever who may be feeling who are going through this. And that's it. Thank you.
Great, thank you very much. Thank you all. Next question. How did your view on social norms deeming the pandemic is over change as you learned about long COVID? Dr. Khan, would you like to go first?
Sure. I think the impact of COVID on our social norms is really, really interesting. I did not have, that break that a lot of people were talking about when they were home during the pandemic. At the beginning of the pandemic, I was not away from work. I was working more than I ever had because I was showing up in the hospitals. But when I met with my community members and my friends who were not in medicine and had this time at home and an interruption in their normal routines, many of them shared that it was kind of nice to slow down. It was kind of nice to have a bit of a change. Of course, the fear of infection is aside from what I'm speaking about. And so I thought this would be an opportunity for us as a society to reflect on what is important to us, the role of work, the role of balance in our lives. And maybe we were doing too much or doing more than we were spending time in ways that were not satisfying to us. And so this was an opportunity to change and to shift. Unfortunately, what I saw as the years went on was a return to these quote unquote norms. I'd hear my mom friends saying, oh, I have to, chauffeur my kid from here to there, soccer practice, after school activities, going to church, going to social functions. And they were stressed out. And so for me, it was a little bit disappointing to see that we did not take the opportunity to change intentionally. And I think that speaks to how strong the connection to norms are, how comforting it is to do things the same way they've always been done. But we can't do that. We have to together decide on how we want our culture to shift. Excuse me. And I think there's an opportunity here to shift towards a society that is more inclusive and more safe for all of us. I'm going to take a pause here and take a drink. So speaking of safety, masking is a big part of that. I'm disappointed to see so much pushback. And also what I have noticed is that there's a lot of people who feel very strongly against masking or taking precautions to prevent a COVID infection, because I think there's an underlying belief that certain people are not susceptible. They're stronger. I'm sorry, it's perfect timing. Just when I want to talk, I start coughing. There's a tickle in my throat. Yeah, so I'm seeing this idea that, some people believing that, physically they are strong enough so they don't have to take precautions, that for some reason their lifestyle is morally superior and protects them from getting infected or falling ill, and that the only people at risk are those who are weak. And it's been really humbling and kind of disappointing to see this ableist language and these ableist beliefs pervasive in our society. I also feel sheepish that I didn't see this until I myself had physical limitations. So this is a really big question, and that's my 2 cents about it. But I think our social norms still have some room for improvement.
Thank you, Dr. Khan. Cynthia, how did your views on social norms during the pandemic over change as you learned about long COVID?
I was in college at the time, and I remember the day before we went and sat down, I was actually in the class on advocacy for people with disabilities, and it completely changed my world view of going to school. Actually, I had to go from being in person where I can be around everybody to going online. And then the following year, I went online to go get my master's degree. I'm gonna have to say it was really difficult for me to the worldview change where I'd rather be in person, I'd rather be getting involved in activities, because the school that I went to, there was hardly any activities at the time. So I had to change my view that this is the reason why they're doing it. They're putting us in isolation is to keep us safe where we don't get sick. But at the time, I made a good friend. Her name's Jessica, and we got to know each other and learn from each other that it's okay to be around each other. And to and eventually, as things got closer to us going out, I was able to realize that accept that I can go to classes online, I can do a virtual internship, and it just changed my whole view on going for in person all my life to school to just being able to do class, go to school from home. And that was my big perspective on the worldview of how COVID changed things.
Thank you. Vicky, how did your social views on social norms determine the pandemic over change as you learned about long COVID? Vicky, do you want to answer this one?
Sure.
Thank you.
I would like to say that learning about long COVID also reveals the deep disconnection between social and ongoing realities, that it still exists, and it's not over. And people in our communities are still at high risk and suffering long-term consequences. And so that versus if it's over, it's not. And people still are affected and also mentally exhausted too. And I wanted to highlight that, we still have to do better in also bringing change in our community. Also acknowledging that, how can we be more understanding, more knowledgeable what people are going through. So I wanted to share that. Thank you.
Thank you all very much. The next question, how can people who have previously not been aware of long COVID and its effects on the disability community advocate for COVID-19 long haulers moving forward? Dr. Khan?
Sure. So I think the key is increasing our awareness and improving education on long COVID. This is easier said than done. I am seeing, as a physician, We still have a long way to catch up in medicine. My fellow physicians don't have all of the knowledge that they need to recognize and treat long COVID when they have a patient coming in with a confusing set of symptoms that appeared after their COVID infection seemed to get better. So one thing got better and another set of symptoms appeared and got worse. So it is when you don't have even a medical system that is um, prepared or educated on long COVID, it's going to be really hard to disseminate really good information about this disease. And so I am very interested in ways we can improve medical education among physicians and other healthcare workers about the truth behind long COVID. This is a disease that is similar to other diseases that have occurred after an infection. We talk about mostly myalgic encephalomyelitis, chronic fatigue syndrome, which is considered to be or theorized to be a post-infectious syndrome. And long COVID may also be a post-infectious syndrome. Well, it clearly is. What does this tell us, and what can we learn from existing research on ME/CFS and Lyme disease, for instance? And what are the mistakes that we've made in medical education that we might be able to improve now? So I think that the key here to get the general population more aware about long COVID and specifically its impacts on the disability community is, one, improve medical education for those first line providers, typically primary care providers, on the truth of this emerging field and keeping them updated, just the same way that we as physicians tried to keep updated on acute COVID. We were learning things every week, it seemed, not only on the ways the COVID infection was presenting, but also on treatments. And we have to do something similar for a longer period of time for this post-acute COVID sequelae. So for me, it starts there. And I think we can't educate people, physicians included, about long COVID separate from a discussion of the existing disability community and the advocacy that the disability community has done. What are, in general, the needs of people with disabilities? And how is a pre-existing disability, how does that increase the chances of a long-term disease from an acute COVID infection? So that's my area of interest.
Thank you very much, Dr. Khan. Cynthia, how can people who have previously not have been aware of long COVID and its effects on the disability community, how can they advocate for COVID-19 long haulers moving forward?
I think that it would be really a good idea for people that do have jobs after they acquire long COVID, that employers start accommodating to people with disabilities, or people who have long COVID, and make the job more adapt to their being able to work. Another perspective is providing support groups and peer support groups that of people who have had long COVID, to be able to help people who have just newly diagnosed with long COVID. And then another perspective that I do have is the Social Security Administration. There's no long COVID. You can't get Social Security just for having long COVID. It would be really good idea if Social Security can approve the ability to get SSI and SSDI with being able to be able to get disability for having long COVID and to get that approved eventually.
Thank you. Vicky?
I'd like to say a couple things. Educate yourself and others. Learn, like we said earlier, from who lived and experienced. Share their stories and resources. Also, try to, even in your personal risk is low, continue to normalize masking in high risk settings, improve ventilation, and support policies that reduce community spread. Also, for policy advocacy, I'm a really hard advocate to push on paid sick leave, disability benefits reform, continue funding for long COVID research and treatment, and contact representatives and support organizations doing this work. And then also support accessibility, like we talked, like the doctor talked earlier, is to really advocate for a hybrid work and events. Also healthcare accommodations, not only as pandemic measures, but a long lasting change that support inclusions. We also want to practice solidarity, show up, listen, and just have that conversation, just like earlier about work groups, conversations about health, recovery, and justice. Advocacy is not just about my voice, but also, the community's voice who have been going through the struggle. And I'll stop right there. Thank you.
Great. Thank you all very much. The next question that we have for you all is, what would be your advice in finding appropriate care without an established method of long COVID treatment? What would be your advice? Dr. Khan?
So this, of course, is the million-dollar question. If you have long COVID, or if you're concerned you have long COVID, how do you get diagnosed and how do you get treated? There currently is no FDA-approved treatment for long COVID specifically, but that does not mean there are not tools and treatments to treat the symptoms of long COVID and to improve function for people who have become debilitated by long COVID symptoms. And unfortunately, patients have had to become experts themselves in medicine, and that I think is, really unfortunate to say the least. But it is helpful without becoming an expert to improve your knowledge of the condition, as Vicky alluded to. How do you learn more about long COVID and come in sort of a little bit more prepared than a patient who might have high blood pressure, for instance? Unfortunately, this is sort of a reality that a lot of healthcare providers don't know how to recognize the symptoms of long COVID. What is helpful, however, even if there is not a treatment for the underlying condition, you can really utilize parts of our very powerful healthcare system to get treatments that make you feel better. And so that has been the key to my recovery. One way to, find appropriate care is to start with your primary care doctor and tell, Vicky was talking about storytelling, and unfortunately with I'm realizing how important that is. And unfortunately, with long COVID, a lot of us have cognitive impairments, and it's really hard to even answer the question, how are you feeling? What's wrong? It's hard to tell a story. And so for patients who have a slew of new symptoms, finding a way to organize their symptoms or better understand their own bodies is a really helpful first step. How am I feeling? What is bothering me? What makes me feel better? When do I notice I feel worse? And so that's what my platform, Long COVID MD, is really focused on too, of how do you understand your symptoms? How do you track your symptoms? Because once you understand your own body and what is really bothering you, you can then collaborate with a healthcare professional and say, this is what I'm presenting with. These are really my problems. This is really what's bothering me. So apart from trying to do this really difficult work of becoming a medical expert yourself, try to become more in tune with yourself. Learn what your story is. Be curious about what has happened to you, and that way you can communicate your story, including your struggles, with others. And I know somebody mentioned the Bateman Horn Handbook in the comments. I wrote the opening of that handbook. It is really helpful. I think as I'm reviewing it, it's actually can be a really powerful resource for healthcare providers. I feel very heartbroken that patients have to feel like they have to find their own treatments and are sometimes finding treatments, from overseas and going to really great lengths. So what I suggest is starting with yourself and paying attention to your story.
Thank you very much, Dr. Khan. Cynthia, what would be your advice?
My advice would be similar to Dr. Khan. Definitely advocate for yourself when you go to your doctor. I had to write down everything, all the symptoms that I was having at the time. And I went in, and then that's how I got approved to go to the long COVID unit. And then create community in where you live, whether it's a peer support group or a group of friends from church, or to help support you at the same time that you're going through long COVID. And if you have a job where you're going, do that, advocate for yourself for longer, to be able to get approved for accommodations during that time as well. And that's what I had to do. I had to go in and advocate to get longer time on test and for college, and I had to go in and I almost took a year off and just went the next year, but I hustled through it and was able to graduate that year just because I had to advocate for myself to basically make my college experience more accessible while I was going through the long COVID experience.
Thank you very much. And Vicky, what would be your advice in finding appropriate care without an established method of long COVID treatment?
I would say a couple things here is to piece together like a team that could, including your PCP who listens and validates your system and is willing to collaborate and learn with you. Also, like earlier, like what everyone is saying is right on point. Document everything because this is your body. Track your symptoms, your triggers, medications, and your responses. And it helps you managing your own care. Also, a timeline also included. And also, like earlier, connect with, patient communities like peer support, and be able to, share your symptoms as well. Advocate for yourself. Sadly, sometimes you would have to, bring a trusted person to your appointment so that they can help you also go walk through this, also understand with um, um, what you're going through as well. Prepare to, bring documentations, articles, and then ask if referrals if needed. Also, wanted to share that, long COVID also disrupts every part of life, whether it's work, relationship, and it's okay to, that if you're going through, um, you know, um, a struggle, is that, there is, support groups or peer counseling that can also help. But I wanted to give a final thought that whoever who may be going through is that you are not alone. Even if the system often makes it feel that way, long COVID is real and you deserve care, validation, and community while navigating it. Thank you.
Thank you all very much. And then I do have one backup question for Dr. Khan, if you're available to answer this. My question is, while there are now resources to make COVID-19 infections not as bad as they could be, like vaccines and Paxlovid, it is still one of the leading causes of death, according to the World Health Organization. As a medical worker, does your clinic still get a lot of COVID patients? If so, what do you think the public can take away from your experience around long COVID and its impact on the community?
Yeah, so I am not working as a physician. I'm still not able to work as an anesthesiologist anyway. I am still very much a physician. And so I will take the moment here to plug my podcast and my newsletter, longcovidmd.com. I called it Long COVID MD because my medical business was called Zeest Khan MD, and I started thinking I wasn't a doctor anymore after being away from medicine and in bed for so long. And I was thinking to myself, well, I'm no longer Zeest Khan MD, I'm Long COVID MD. And it helped me remember that I'm still a doctor and that I can still help other people. So I don't see patients in a clinic with long COVID, but I certainly work with and communicate with a lot of patients who are struggling with long COVID through my online platform. And you can hear about my story on the podcast and on the website and all of the episodes that I've done. But what I am learning specifically about the impact on the disability community is that a lot of people with long COVID did not have pre-existing disability. And I think this is just like the pandemic itself has been an opportunity for us to shift our ideas about community. I think, at least what I'm doing is trying to remind people that they are now part, if you have long COVID, you are now part of the disability community. And even if you improve to the point where you don't have a disability anymore, it's really important to not forget the disability community and to make a positive impact on it and to advocate. And as both Vicki and Cynthia have said, relationships are so important. Allyship is so important. And so what I hope the public can take away from my experience about long COVID is one, understanding long COVID, understanding what we need from medical research, understanding ways to apply our medical resources in a new way to meet the needs of people with long COVID. And then on the other hand is how do we ally together and think of ourselves as a broader community? Because we are all vulnerable. If you have a human body, you are vulnerable and you will experience vulnerability at some time in your life. What I think a lot of people in our culture believe is that for some reason or another, they are not going to be vulnerable. And so that might be a way to live in the world without worrying, without fear, I guess, but it's not truthful. So that's what I hope people can get from my story, and that's why I'm trying to share it.
Thank you very much. And then somebody asked in the questions if for the Bateman handbook. I'm going to put the citation in the chat right now, but if anyone has a direct link to it, that would be helpful too. We also have another question in the chat. This is from an anonymous attendee who said, from my trip to Norway late June to early July, my doctor recommended that I take an extra dose of COVID vaccine so I wouldn't be as impacted if I picked COVID up on that trip. Both pharmacies I tried initially rejected my request, even though I told them that my doctor wants this for me. They cited that since the CDC was not recommending my booster for people under 65 yet, they couldn't give it to me. Finally, I got my vaccine at my local QFC, where my doctor herself called them. If anyone is doing anything really COVID risky, like going overseas, would you recommend getting a booster shortly before that activity? And how would you approach this, given pharmacies think they have to comply with what the CDC says? Are there any panelists that would like to answer this question?
So it's a little bit tricky because, I can't give specific medical advice, but it takes in general a few weeks for any vaccination to offer you protection against the infection. So timing, you're right, can be helpful if you get the vaccine within the appropriate window of time. And then for the COVID vaccine, depending on which type you get, there is a limit to how long it offers protection, which is a big, important subject right now. How often do you need to be vaccinated? And so there are, like today, in COVID news, the Department of Health and Human Services is recommending limiting offering COVID vaccines to anybody under 65 here in the United States, unless you have a pre-existing medical condition that increases your risk. So that is a very big caveat, and that is something that cannot be denied, and that might have been what your doctor called the pharmacy to do. It is a little worrisome that there are obstacles to care, and we have seen some people like pharmacists. There's been a couple of instances where pharmacists have felt that their goal is patient safety. And so it is important to get sort of the approval of your pharmacist before you get them access to the medication, because they're doing what they believe to be the right thing for you. But if you are interested in getting a COVID vaccine, if you have asthma, cardiovascular disease, a pre-existing physical disability, increases your chances of developing a severe infection, and it increases your chances of developing long-term sequelae of COVID. That may be enough. That should be enough for you to access a vaccine if that is safe and appropriate for you.
Thank you very much, Dr. Khan. And we have one more question for you specifically. Is there a specific scholarship that you could suggest to those who want to dig deeper into the impact of long COVID within the disability community?
So I joined Substack, a social media platform that is focused on writing. And there I have met multiple people who had pre-existing disabilities, who have allied with the long COVID community and write extensively on living with disability, including complex illness. And so if you go to my Substack page, you'll see some of those recommended on my recommendations list. That would be a nice place to start. In terms of established scholarship on long COVID in the disability community specifically, like research, I don't have resources for you yet, but that's a great question that I might dig into.
Thank you very much. And they can access that through longcovidmd.com.
Yes, and I'll put my Substack do you want me to put it in the chat or the Q&A?
The chat has your URL currently. Thank you for sharing that.
I put my Substack link too.
Thank you very much. Okay, so we are getting finished. If there's no more questions from the audience, reminder again, if you have a question, you can type it in the question and answer or in the chat. To the panelists, is there anything else that you would like to share? Or anything that we didn't cover? Okay, if there's anything that comes up later, you can just message me and I'll share with everyone who attended. So before we adjourn, I'm sorry, it's a little bit early, so we get a break in our day.
Hey, Mario, 1 second. Dr. Khan came on camera. I didn't know if there was something else she wanted to share.
Thank you.
No, just wanted to thank you guys for having this presentation and allowing us to join.
Thank you. And thank you to Colin for getting this started. So before we adjourn, I would like everyone who attended to please take a moment to provide us with some feedback. You can either access a quick survey via the QR code in the PowerPoint or via the link in the chat that I will share right now.
It's done.
Oh, Kimberly already shared it. Great, thank you. So please access the feedback survey with either the QR code or the link and let us know. So thank you to, okay.
And I had to turn my video back on. Sorry. And again, thank you to our wonderful panelists. I appreciate your willingness to share your stories with us. And I hope that we can't wish COVID away, but I hope that definitely people learn to become more tolerant of people who are still experiencing the impacts of COVID. It's definitely something that I think needs to occur. I would like to thank all of our attendees as well. And as a reminder, this event was recorded and you can view the video later at the Disability Empowerment Center's YouTube channel. And I just put the link in chat. And our June webinar will be about how design can become more accessible, and it will be on Tuesday, June 17th. Thank you again, and have a wonderful rest of your day. What'd you say, Vicky? You
Said
were
thank you,
muted.
everyone.
You're welcome. Thank you for being here.
Thank you.
Thank you, ASL and CART. Much appreciated.